This is a video about the admission process for paediatric patients prior to cardiac procedures. Before the procedure, the patient will be asked to attend pre-admission clinic to ensure they are prepared and ready for the procedure. This will be in the Carousel Outpatient Department on Level 3 of the Children's Hospital. Procedures to be carried out can include nostril and groin swabs to check for MSSA and MRSA, echoes and ECGs, chest x-rays, blood tests, an examination by the doctor to ensure the patient is fit and well, meeting with an anaesthetist for those having cardiac surgery, meeting with the cardiac nurse specialist. Research nurses may also wish to speak to you. The cardiac nurse specialists will make sure you are aware of the specifics of your admission, including dates, nil-by-mouth times and medication advice. Don't hesitate to ask them any questions that you may have. Admission date. If you don't have a date for admission yet, you will receive a call from a member of the bookings team once this has been arranged. They will try to give you as much notice as possible. We will also aim to phone you within 72 hours of your child's admission to check that they are fit and well. If you have any concerns or they develop any gastro or respiratory symptoms, please call the cardiac nurse specialist team on 0117 342 8286 or Dolphin Ward after 4 p.m. and on weekends on 0117 342 8332. Otherwise, on the morning of the procedure, please phone to check for bed availability. You can contact either Dolphin Ward on 0117 342 8332 or the number on your admissions letter. What to bring for your stay. In terms of what to bring, please feel free to bring things that will make patients feel more comfortable, such as comfortable clothes for day and night time, pyjamas, slippers. If your child is having cardiac surgery, please bring tops that button up down the front. If your child prefers a particular type of feeding bottle, we suggest you bring this with you. Toiletries, such as a toothbrush and toothpaste, any blankets, teddies or comforters, medications if your child is on any, and nappies. Please bring enough supply for the duration of the admission, or any other items to make your child feel more at home whilst in the hospital. However, please be mindful not to bring too much as there is limited space on the ward. What is provided? We have a number of facilities and equipment for you to use. Sterilising equipment, breast pumps, facilities to store expressed breast milk. Food is provided for your child and for breastfeeding mothers up to 6 months. However, if your child is on a special feed or milk, we ask that you bring this with you. There is a playroom and shared play equipment on Dolphin Ward that you are welcome to use throughout your stay. On both Dolphin Ward and Paediatric Intensive Care, there is a parent kitchen with access to a fridge, toaster and microwave. You are welcome to leave food and drink in there. However, if you do, please label it with your child's name. Parental accommodation. On Dolphin Ward, by every bed space there is a pull-down bed for one parent, which will be required to be pushed back up during the day. The ward will provide you with bedding and a pillow. There are also accessible shared bathrooms on the ward for all parents to use. If your child is in the high dependency unit or paediatric intensive care unit, there is not the facility for a parent to sleep at the bedside. You will be required to ask for accommodation upon admission for surgical patients. Non-parent visits. Currently, on both Dolphin Ward and Paediatric Intensive Care units, non-parent visiting is from 8 a.m. to 8 p.m. They would kindly request no more than 2 adults and siblings at a time. Thank you for watching this video.